ABC News senior national policy reporter Ann Flaherty joins me now for more on this. And these conflicting rulings are creating a lot of confusion. So where do things stand right now in terms of access to this medication?
Yeah, absolutely. So right now we have 36 states plus the District of Columbia where people can purchase these pills or get them prescribed by a healthcare provider. Now, all of that could change by Friday. That's when this judge's ruling is supposed to take effect, unless the higher courts, the Fifth Circuit Court of Appeals, weighs in on this and provides the government emergency relief. So what that means for people is that as soon as Friday, it could happen where the manufacturers of this drug simply have to stop production. They can no longer distribute the drug. Now, the twist in this is that if an abortion provider still has the drug on hand, legally they can provide it to anyone who asks for it. So what we're seeing are states like Washington that have already purchased this in bulk. They say they have a 3-year supply for this drug.
Now, Mifepristone has been available for more than 20 years. So what's the argument, and it's FDA approved, what's the argument for banning it now, and what happens if that ruling stands?
So I've interviewed the conservative plaintiffs on this. They say they have been fighting this for years. They say that the FDA is politicized and has ignored safety data. And they found a judge who agreed. He used all of their language from their complaint, referred to fetuses as unborn children and said they needed to be protected, that this drug harmed them. He also said that the FDA didn't do their due diligence in examining, for example, the psychological effects of taking this abortion drug. So a very sympathetic judge. We're going to see what happens as this moves into the upper courts. But the abortion advocates I've talked to are not hopeful. They say the Fifth Circuit is the most conservative appeals court in the country. They expect that this nationwide injunction on this medication could happen very soon.
And now experts say this could go all the way to the Supreme Court. So what are you watching for here?
So we have these two dueling rulings that you referred to, this Washington judge that says the FDA has to keep this on the market. And then, of course, you have this Texas ruling that says they can't keep it on the market as of Friday. So what we're going to see is this expedited movement toward the Supreme Court to deconflict those two rulings. Now, we don't know when they'll rule because the Fifth Circuit has to weigh in first. But we expect this to be an explosive case. And one thing, Diane, I should point out, I think this goes beyond just abortion. We're talking about a judge that has challenged the FDA's expertise on drug safety. 6 months from now, we could be talking about vaccines, other drugs as well.
All right, ABC News senior national policy reporter Ann Flaherty, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.